All right, I think we have a special guest here, Dr. O'Connor.
Yeah, Dr. O'Connor, how you doing?
Do you see
Christian,
him?
all right.
Okay, yes, hi.
Hi.
Hi, Doc.
Hi, guys, how you doing?
Good,
Very
thank
good.
you.
Are you in Florida now, or?
Yes,
we are.
Yes,
Yes, we
suffering here, yes.
Yeah.
It's cold out today. It's 70, a little windy.
Oh, I feel bad for you, real bad. Yeah.
So when we came up, it was getting ready for the holiday. Well, by the next morning, my oldest daughter, woke up not feeling well.
Within 2 or 3 days, all 8 of us were sick. And we went for a test and it came back positive. Our blood oxygen count, which is indicative of a serious problem, was dropping. Lucia was down to 90. I was down to 88. We went in, the clinic was open. That was the first day.
How do the monoclonal antibodies work, if you don't mind just kind of going through that quick?
Well, the antibodies, which are molecules that are normally made by a vaccine in your body, directly infused to a patient, and they interact with the COVID organism and they stop it from becoming infected. They have to have the antibodies within 10 days of the onset of the illness.
It was such an easy experience. We sat there, they gave us the intravenous.
And it took you about a day to get better, right?
Well, we started getting better by the next day. My blood oxygen went up
From 88 and started coming
rising,
up.
and
Yeah.
We really felt progress every day.
In this case, it offered a medication that would not have been given otherwise, because we wouldn't have been able to do it, because we wouldn't have been able to see you or even talk to you. I wouldn't have been able to get in touch with the infusion center. And when patients are ill with COVID, we don't necessarily encourage them to come into the office because we're afraid of getting it ourselves or giving it to the staff or other patients. It makes me feel like it's kind of the only thing I can really offer patients like yourself when they're ill with this, because we don't really have much else to give you to make you get better more quickly. So when I have a chance to give someone the antibodies, I kind of like to do it, because I feel like we're not providing you with any other method to get better, and the antibodies are clearly an advance. The antibodies are very specific just for COVID. It's kind of an amazing thing. It's almost like you got the immunization in that you have antibodies in your system that are being given to you at that very moment.
What do you think about the combination of being able to provide telehealth services during this pandemic to get a treatment like the monoclonal antibodies does this really help in the fight against COVID and hospitalizations, keeping people out of the hospital?
Oh, absolutely. Yeah. For one thing, we can't give it to patients who are in the hospital, because at that point they consider to be too ill to receive the antibodies. So by giving it to them early, we're preventing that hospitalization.
I mean, I wouldn't hesitate to recommend it to everyone to take it. If it's available and you get COVID, foolish not to do it.